Okay, welcome to today's presentation, the second presentation on the peptic ulcer disease treatment by dietary management. My name is Nasiru Eric Morishdi. I'm a clinical dietitian and nutritionist. In the first presentation, we discussed on the pathophysiology of peptic ulcer disease. We saw a lot of things, a lot of information on the causes, clinical presentation, medical treatment, and surgical treatment. Here we are going to finish up on the dietary management of peptic ulcer disease treatment. Later we call back. As I told you in the first presentation, please, and over please, my dear, please, I introduced well on peptic ulcer disease in the presentation. Please, through the previous presentation, if you don't have, please get download on YouTube or find it doctor name in YouTube so that to get a full package concerning with the peptic ulcer disease. In the peptic ulcer disease, we have duodenal and peptic ulcer, duodenal and the peptic ulcers. The duodenal ulcer occur in the duodenum, and the peptic ulcers occur in the what? In the stomach. Sorry, the duodenal ulcer and the gastric ulcer. The general peptic ulcer we are divided into duodenal ulcer which occur in the duodenum and the gastric ulcer. Sorry, this is the gastric ulcer. The duodenal ulcer occur in the duodenum, but the gastric ulcer occur in the gastric portion. In the duodenal ulcer has some indication which can help us to differentiate from the gastric ulcer. In the duodenal ulcer, epigastric pain occur 1 to 3 hours after eating, which is unlike to the gastric ulcer which occur within 15 to 30 minutes after eating. It is important to note here when the food are being eaten, when the food enters the stomach, in the stomach here we have a pyloric sphincter. Therefore, the pyloric sphincter closes. Therefore, for proper digestion of food in the stomach. When the pyloric sphincter closed, the stomach, the food is inhibited from being entered into the duodenum. Therefore, during eating, the stomach pyloric sphincter closed. Therefore, there is no passage of food into the duodenum. When the food, after being digested 1 to 3 hours after being digested in the stomach, this food, the pyloric sphincter allow the food from the stomach to move from the stomach into the duodenum. Therefore, if a patient have duodenal ulcer, will experience a pain between 1 to 3 hours. That is the reason why epigastric pain occur 1 to 3 hours. But for gastric ulcer, the pain occur during eating or 15 to 13 minutes after eating. That is why during the presence of food in the stomach, it is where the parietal cells secrete hydrochloric acid. Therefore, when secrete the hydrochloric acid, an acid causes an ulceration. An ulceration, when enters into the what? Into ulceration, they causes pain. Therefore, that is why we are talking that the gastric pain occur in 15 minutes during eating. And that is the reason why when a patient during eating when senses pain can stop to eat, can stop to eat. And is that why, therefore, when stop to eat, we may have an effect of weight loss in weight loss. But if patient have duodenal ulcer, that means the patient will eat and the food will enter the stomach. When entering the stomach, therefore will move again to the duodenum. Here we'll have a weight gain. Then also relieved by eating and acid. That is the reason I have explained already. During eating, the pyloric sphincter are closed. Therefore, there is no passage of food into the duodenum. There is no passage of food which will cause the pain in the duodenum during eating. Therefore, when a patient with duodenal ulceration will not experience the pain during eating, but he will experience pain several hours after eating. But also period of symptoms alternate the period remission. But also may interrupt sleep. When someone go to sleep after eating, go to sleep, for instance, at night, the food are being digested in the stomach at a certain time, for instance, hour. After an hour, the food will pass from the stomach into the duodenum. When entered to the duodenum, interrupt the sleep. That is why we are talking that duodenal ulcer interrupt sleep, but the gastric does not. But also the duodenal ulcer is associated with what? With the weight gain. Those are indication that can make you to identify that you have an duodenal ulcer or gastric ulcer. But also we have got complication of the ulcer. We have bleeding. If an ulceration, it is deeper to the blood capillaries. From the stomach to the blood capillaries, the blood can pass can pass through an ulceration into the rumen. Entering the rumen can mix with the content, so that cause bleeding through vomiting, hematemesis, vomiting, or urinary stool, the discoloration of the stool. But also we have perforation. This is among the complication in which there is allowing of gastrointestinal content like gastric secretion and undigested food into the peritoneal space. Mostly for duodenal ulcers, when perforation occur, air collecting under the diaphragm, causing irritating nerve. That is, we hear in the water, in the pain up to the referred to the shoulder pain up in the shoulder. That is perforation. That means the gastrointestinal content are moved into the peritoneal space. For instance, the gastric secretion and the undigested food. These are mostly occur in the duodenal ulcer. These occur mostly in the duodenal ulcer. But also we have gastric outlet obstruction. These gastric outlet obstruction in some cases may causes blood vomiting. But also we have pancreatitis. The pancreatitis is among the complication of peptic ulcer. But we have alarm symptoms. The alarm symptoms, we have bleeding, weight loss, but also progressive dysphagia, difficulty in swallowing. difficulty in swallowing can be an alarm for ulcer. But also we have iron deficiency anemia, since there is a loss of blood through an ulceration in the mucosal lining. Therefore, if there is a loss of blood, an iron will be lost in the blood. But also we have recurrent emesis. These are alarm symptoms that can indicate you that there is an ulceration. Thank you. Therefore, let us jump on treatment. Dietary management of peptic ulcer disease. On the dietary management, let us first we look on the foods to avoid. There is foods to avoid for patient having an ulcer. The first is the coffee, tea, and chocolate. These food, tea, coffee, and chocolate for patients with PUD, peptic ulcer disease, have to avoid this food because it increases the acid production in the stomach. When increase acid production in the stomach, the acid can cause ulceration of the ulceration of an ulcer. Therefore, we have to avoid it. But also we have spice foods and chill. We have spice food and chill. These also are not important for patient having peptic ulcer disease because this food influences an ulceration, but also this food for also we have a processed food. The processed food also may promote, for instance, the processed sugar may promote the development of H. pylori. But also we have acidic and citrus fruit. The acidic and citrus fruit, these irritate an ulcer for some individuals and causes hyperacidity. This is for some individual. That for some individual increases acid production. Therefore, we have to avoid, for patients having PUD, they have to avoid an acidic and citrus fruit. But also we have deep fried, oily, or fatty food. We have to avoid. We have to avoid this food, deep fatty, oily food. Why? For the reason that a patient who utilizes the proton pump inhibitor, that means there is low acidity in the stomach, and this fatty food has slow the digestion. Therefore, in the stomach there will be increase of an acid in the stomach for digestion. This acid, when are being secreted in higher, they cause an ulceration. But also you have alcohol and tobacco. And alcohol irritate the ulcer in the stomach, but also we have tobacco impair the healing of stomach ulcer. But also we have to avoid the larger portion meal, as how we can look here, the small meal, the second, the third. Here we have the small meal. For a patient with peptic ulcer disease must utilize the small meal, must avoid the larger portion, must avoid. If the small meal, can take the small meal frequently in a day, because when we take the larger meal will increase the stress and will increase the hyperacidity in the stomach, causing an ulceration. Therefore, if the patient must start small, then the following, and then the next. That is the concept about the meal of peptic ulcer patient. That is, and if the patient cannot tolerate the solid food, can utilize the semi-solid or liquid or blenderized food. If cannot tolerate, the body if cannot tolerate, and then after there can shift it into the what, from liquid into semi-solid, and if the normal condition have been attained, can utilize the solid food. That is food that we must avoid. But also we have the food that help to the treatment of the peptic ulcer disease. The first one, we have flavonoids. The flavonoids are compound having anti-inflammatory activity and antimicrobial activity. These flavonoids have anti-inflammatory activity and the antimicrobial activity. Therefore, they provide gastroprotective activity in the stomach. Remember, a patient having who utilizes proton pump inhibitor obviously will decrease an acid in the stomach. When there is decrease, there is increase in the acidity in the when there is when the pH rises in the stomach, these provide an environment for Helicobacter pylori to increase. When this Helicobacter increases, therefore these flavonoids can help antimicrobial activity, that is means to decrease. As also these flavonoids as legumes, apple, bell pepper, cold green tea, the bell peppers, apple, and legumes we have has fiber content, has a high fiber content that help in the GI motility, gastrointestinal motility, therefore aiding the movement of food through the gastrointestinal, therefore helping to avoid the increase in ulceration of peptic ulcers. Therefore, but also other food, we have probiotics. Probiotics, these are good microorganisms that help in our body to that found in our body. This probiotic can be provided as supplement to the patient, so that when enters the stomach through the concept of competition, that means we are decreasing the Helicobacter pylori, the bad bacteria, and we are increasing the good bacteria in the what, in the stomach. For instance, we have lactobacillus. The food lactobacillus, which are being used in food and fermentation of some food as milk, can be used or can be better or can function as probiotic, so that to aid us to overcome the increase of Helicobacter pylori population in the stomach. Therefore, we can try the probiotics so that to lower the bad bacteria in the stomach. But also we have honey. Honey contains polyphenol and antioxidant that help to avoid the free radicals that found in the water in the body and around an ulceration. But also we have garlic. The garlic are these. We have garlic. The garlic here must be taken in small amount. must be taken in small amount. If the body will tolerate, then amount can be increased. This garlic inhibit the growth of Helicobacter pylori, but also has antioxidant function. Therefore, can be utilized for treatment of peptic ulcer patient. But also, we have food with sulforaphane. Food having sulforaphane are based in the most important food for the treatment of peptic ulcer disease. Here we can look the food having sulforaphane. For instance, we have a cabbage soup or cabbage juice. Here, let me tell you a simple story about the cabbage juice. The cabbage juice. In research, it has found that the cabbage contains a certain vitamin, that is the vitamin U. Vitamin U is not a rare vitamin, means the group of sulfur plant-based compound. These vitamin U are sulfur plant-based compound, sulfur compound that found in the plant. And this sulfur, we can call it glucosinolate. Glucosinolate. These glucosinolate destroy the what? The Helicobacter pylori. Therefore, these glucosinolate or sulforaphane, these sulfur are found, kind of sulfur are found in the cabbage juice. And here, therefore, we can utilize the cabbage juice to what? For aim of getting that sulfur compound. That sulfur compound which help to destroy the Helicobacter pylori. And this juice can be utilized in raw or in a cooked. But it is important to note it does not depend on the color of the what? Does not depend on the color of the cabbage. Does not depend on the color of the cabbage. And it is better to be taken in a raw and not in heated form, because when the cabbage are heated to very high temperature, we are going to destroy those sulfur compound. Therefore, it is better to be taken in raw or undercooked. That is an information or an advantage of a cabbage juice. It contains that is important about sulfur. Now, let us end here. This is the end of our presentation. My name is Nasiru Eric Morishidi. I'm a clinical nutritionist and a dietitian. Please, I thank you, but please like, share, and subscribe so that to get lot of information and knowledge concerning with nutrition. Thank you.